Now to the real world example of how this theory can be applied to clinical practice. Okay, so as I mentioned before, at my hospital, we use the Edinburgh Depression Scale. And that's a 10-question survey. And women just fill out a survey, and it's based on how they've been feeling for the past 7 days. Similarly, the postpartum depression screening scale by Beck is a 35-item survey, and it'll take about 5 to 10 minutes. And again, this is also to screen women who are at high risk for postpartum depression, so that if they score high, then healthcare professionals like the physician or the nurse or whoever is qualified to reach out for the next step, they can refer the moms for definitive diagnosis as well as treatment. And this is important because the sooner we recognize the risk factors for each patient and the sooner we help them get treated, the sooner this issue is going to resolve and we prevent it from getting into postpartum psychosis. So this survey is one way we can implement the theory into real clinical practice. And then I think more important than, different. It's equally important, but another important aspect of implementing this postpartum depression theory to clinical practice is educating nurses. From my direct observation of my labor and delivery postpartum unit, I feel that the nurses are not too knowledgeable about the risk factors or the signs and symptoms or how postpartum depression or even baby blues present. So if the nurses have a hard time distinguishing between postpartum blues and postpartum depression, then we're going to have a hard time screening these moms. And instead of just dropping off the piece of paper and saying, hey, I'm going to be back to pick up this piece of paper, if we are able to spend even like 2-3 minutes talking to these moms about their personal unique risk factors and what to look out for, as well as educating their birthing partners, whether it's their husband or father of the baby, the grandma of the baby, or whoever is there to support these women, I feel that it's also important to educate the family members so that if the mom is stuck in a rut, then it's the patient's family members are able to identify, realize and recognize, mama this is not how she usually is. Something is going on here. And in order for these moms and family members to be educated, the nurses who are taking care of these moms during the labor process, even prenatal in the clinic, and especially postpartum period, as well as the follow-up after delivery, these nurses have to be knowledgeable enough to be able to catch these signs and symptoms. So first way to implement it is using different depression screening scales. And then a second way to implement it is to teach nurses about postpartum depression theory and the differences between baby blues, postpartum depression, and postpartum psychosis, and how to screen for them.